When people come to you, when patients come to you, and it's about stress and unmanageable stress, are they ordinarily looking for medication?
They are, unfortunately. There are medications to help with stress and the stressors in very specific situations, like flight anxiety in certain situations, but it's really kind of a slippery slope to get into that because a lot of those medications have a lot of side effects and some of them can be addictive. The ones that are not take some time to work, and the reality is, a lot of patients say, I just want to get over the stress. Well, stress is here. You need to have some way to address the stress.
Well, Dr. Watkins, I know you've always said it's skills, not pills.
Skills are not pills. And so, in thinking about stress, whether we do medication or we don't do medication, we have to be able to teach people how to have skills to manage stress. Before that, know what your signs of stress are, like what you do when you start to get stressed. So do you start to lose sleep? Do you start to eat more or less? Knowing your signs will help you to be able to intervene early before you get to the point where you feel like you need medication. And needing medication is not a failure or not even a sign of that you're not resilient, because knowing your needs and asking for what you need to support yourself is also a sign of resilience. And so we have to start there. But there are medications that we use because, again, there's some people who are just genetically more vulnerable. And even in the lowest of stressful situations, they will, develop more significant responses and look more like someone who has anxiety disorders or depression. And again, then there are people who have had stress upon stress upon stress, and they are able to manage and not develop into something more significant.